Hello and welcome to Painotopia.com. My name is Jan Lingen, and in this video I would like to talk about trigger point activation in the Scalene muscles. I would like to address three topics here, three things that very often activate trigger points in those muscles. Those things are paradox breathing, that's point number one that I want to discuss. Point two will be forceful impacts on the head and the neck area, the area of the cervical spine. And the third point will be postural stress. I will address those three topics in a little bit more detail right now, but before we get started, it might be possible that you are completely new to trigger points, new to trigger point treatment, self-treatment, etc. and have no idea about that whole concept. If that's the case, I highly recommend to check out the free trigger point course. You can sign up for that course by just clicking on the link or the button below this video, and the course will be delivered to you via email. Okay. But then I would say and suggest let's get started right now. The first thing I would like to address here when it comes to trigger point activation in the Scalene muscles is paradox breathing. More specifically, I mean here exaggerated breathing through the chest. Why is that? Why does chest breathing exaggerated chest breathing activate in the long run trigger points in the Scalene muscles? Why is that? Now you have to know that the Scalene muscles are three muscles on each side of your neck that run here from your cervical spine down to the first ribs. And those muscles will assist you in breathing by lifting up your torso a little bit, your rib cage a little bit. That will get lifted a little bit. It helps the rib cage to expand and thus to get in the air to breathe. Now, I said are muscles that assist breathing. They are not primary muscles that for breathing. They're just assist. So usually if we have a full breathing, we will use our diaphragm, we will use other respiratory muscles on the torso too. But if we breathe a lot through the chest, we will have an overly strong activation of our Scalene muscles, and that very often leads to trigger point activation and then in turn to the common pains and problems that the Scalene muscles can produce. More info on those pains and where they can run and what problems the Scalene muscles can give you, you will find on my website Painotopia.com. The link is also in the box below. Now, I would like to dive a little bit deeper in this breathing thing. So why is it that we have chest breathing? Under what circumstances? First of all, this is, for example, in sports, extremely intense sports, heavy physical activity, especially if it's cardiovascular activity, leads very often to chest breathing, to get all the air in that we need for this activity. And this can lead to trigger points. That's one thing. Another thing that is way more common is stress. Stress and anxiety lead quite often to a shallow breathing pattern, which means that we do not use all our respiratory muscles to get in the air we need, but rather we are stressed, we have anxiety, for example, which can be due to a variety of reasons, a lot of reasons. The reasons do not matter at all. Important is just the effect. The effect is of that stress, of that anxiety. For example, you will have a shallow breathing, you will have mainly chest breathing, and that will definitely overload the Scalene muscles, because in comparison to the sports activity, which lasts only a couple of minutes most of the times, if it's super intense, the stress can be there for the whole day. for days, for weeks, for months. So we will have for this period of time too an alternated, not very optimal breathing pattern, which focuses on breathing through, through the chest, and that can activate trigger points in the scalene muscles. Okay, having said that, I would like to move on to the next topic. Let us now talk briefly about the heavy impacts on the head and how they can affect the scalene muscles and how this can activate trigger points. With heavy impacts on the head, I mean anything that comes from the side and hits your head from the side, any force, and that will lead to a lateral flexion, like a side bending of your cervical spine. Examples might include martial arts, kicks to the head, hits to the head, car accident, someone crashes you from the side, bicycle accidents, you fall, your head gets thrown into one direction or the other. All those things can involve heavy impacts, heavy forces that will affect your head from the side and lead to this movement. Now, why can that become problematic? Your scalene muscles are muscles that are located here at the side of your cervical spine, and when it comes to movements, they will flex your spine to the left or the right side. This is actually now my left side and this is the right side. So when you will experience a forceful impact from the side, your head will get tilted, your spine bends into this direction, for example, if the force comes from here. And this will lead to a rapid and most of the times unexpected stretch or elongation of the scalene muscles of that particular side. And that can activate trigger points. Why that is, I do not want to go in too much detail here because it involves some physiology about muscle spindles and how they react to elongations of the muscles. If you're interested in that, as I mentioned at the beginning of the video, there's a free trigger point course that will also address those topics, the physiological basis of trigger points, or at least a huge part of it. So feel free to sign up for that free course by clicking on the link or the button below this video, and it will be delivered to you via email. Okay, now last but not least, I would like to talk about, what did I write here? Postural stress and how that can activate trigger points in the scalene muscles. Because the topic of postural stress is such a complex one, I would like to give you here only one example and try to explain you why that can lead to an activation of trigger points in the scalene muscles. An example is an abnormal positioning of your pelvis. More specifically, if your pelvis is a little bit higher on one side or the other. If it's positioned in space so that one side is higher than the other. There are many reasons that can lead to this abnormal positioning of the pelvis. Two examples: you sit all the time on your wallet and one side of your butt and thus one side of your pelvis is permanently pushed upwards and leaves one side of your pelvis lower than the other one. Another example might be anything that causes you to limp. Because when you are limping, when you have an abnormal gait pattern, you repetitively will pull one side of the pelvis upwards. So we have here now a permanent elevation, a permanent, something permanently pushing up the pelvis, or repetitive movements. So how does that translate upwards? It's quite easy. Your pelvis is connected with your spine. And as soon as your pelvis is positioned a little bit differently, a little bit higher on one side or the other, this movement translates upwards to your cervical spine. And let's say we have something under our butt. I would move into this direction, right? If I have something here, if I put my hand as an example for a wallet under my butt, I would sit in this way. But I do not want to sit like this. My brain does not want that. It wants to align us. So what happens? I sit like this. And now I have an abnormal positioning of my spine, of my shoulder, of my cervical spine. So it's quite complex, but the end result is that the scalene muscles that are attached and that move your cervical spine, they are attached to the cervical spine and move it, will become active on one side to correct for the abnormal flexion, for the abnormal positioning of your spine, to align yourself. And on the other side, they have to stretch, they have to elongate. And a permanent contraction of a muscle, as well as a permanent elongation of a muscle, lead to an activation of trigger points. Why that is quite complex. It has to do something with diminishment in blood flow and thus in oxygen supply, and then we're talking about energy production in the muscles and talking about different chemical milieus in the muscles and how that affects the whole system there. That's going too deep for now. But you just have to know a deviation from your gait pattern. Something that pushes your pelvis upwards, that influences the positioning of your pelvis, will eventually translate all the way upwards to your cervical spine, where your scalene muscles will correct the positioning or the position of your cervical spine in order to give you the feeling that you are upright and aligned, which you are, of course, not. And this permanent contraction of the scalenes on one side and the permanent elongation of the scalenes on the other side will lead to trigger points. It's a very interesting thing because those abnormal positions of your pelvis, they can come from your feet, from your ankles, from your knees, from your hips. That means problems in the lower extremity can eventually translate all the way upwards to your cervical spine and give you problems in your scalene muscles, can activate trigger points here, and then you can develop chest pain, arm pain, finger pain, because you have an issue in your ankle. Isn't that interesting? I think it really is. I really hope you enjoyed this video, and if you did so, I would be happy if you could subscribe to my channel or leave thumbs up for this video, and maybe we will see each other in one of my other clips. Bye bye.